Hi, I'm Sloan Manning. I'm a PCP Section Advisor for PsychU. Wanting to bring an update to you today about trends in behavioral health and how it impacts primary care. And really wanted to talk to you about PsychU and the PsychU app and one of the best things about PsychU. And one of the best things about PsychU that I've seen recently is this article for which there's a link on PsychU. It's called Trends in Behavioral Health. This is actually the second edition that PsychU has done on this topic. And I just wanted to cover several of the major themes of this document. You can actually download it, print it out as I have. I think it's valuable enough as a reference to talk about. But just in general, discussing where we're going in terms of population management, healthcare in the U.S., what's changing, what'll change for you and for me in primary care and for our colleagues in behavioral health. One of them is how healthcare is viewed. It is going to take on a more integrated and holistic view as we go forward, and that's going to mean several things for people in primary care. It's going to mean more providers are going to be offered opportunities for integrations with behavioral health entities, and that might be a near-site or on-site opportunity where care managers or behavioral health professionals actually practice side by side with you. The flip side to that coin is that primary care is going on-site to behavioral health settings in the future, because one of the things that people with serious mental illness lack most is actually attention to the basics of healthcare. And so the idea is to reduce barriers, to eliminate barriers, geographic barriers, cultural barriers, physical barriers, any kind of barriers that we can reduce, both in time, space, and in interdisciplinary collaboration. You're going to see more of that. Some of you may have already been offered opportunities to become part of accountable care organizations where pay-for-performance or some at-risk arrangement is in view. Or you may have been contacted by your community mental health center who may have recently become a certified community mental health center. So they're looking for connections to you as well. And I would encourage you to be open to those care possibilities. Becoming more mobile, becoming more integrated, becoming more collaborative is going to be a good thing for everyone, I think, both in the standpoint of providers, provider skill levels as we share information among disciplines, and also our patients are going to get better care. We're also going to be seeing this collaborative view of, and more holistic view of primary care and behavioral medicine in terms of connectedness to long-term services. So some of the barriers that have kept our patients from getting into long-term service support are going to disintegrate as we become more unified and integrated in how we take care of each other. Across healthcare systems, you've already seen portability of insurance coming into play. You've seen electronic access to healthcare records. Those are other ways in which barriers that patients experience from the standpoint of obtaining and becoming self-actualized in healthcare are going to go away. So it's a world that is becoming smaller in terms of the patient is going to become closer to care. Providers are going to become closer to their colleagues, and as we get closer together, talk more with each other, and the patient becomes an integral part of their own healthcare planning, everybody's going to be better served. And in fact, if we don't do these kinds of integrations and collaborations, we won't get paid, because the people who are looking at the data, who are paying for healthcare, and that's both commercial payers, Medicare, Medicaid, everyone recognizes that the disparities in healthcare, the obstacles to healthcare have got to go away, and it's one of the reasons why this country spends way more on healthcare than other countries, is because we've created these barriers to getting what people actually need. There's also going to be an emphasis in consumer engagement, and the goal for that is improving self-actualization. So I have my smartphone, it's about 3 or 4 feet away from me. Did you realize, or maybe you didn't know, that 90% of US adults have a smart device within 3 or 4 feet of them 24 hours a day? And that fact has not gone unnoticed on people who are involved in healthcare. So now you are seeing healthcare systems that are reaching out to touch you, to converse with you, to deliver cognitive behavioral therapy in a smartphone app, to text you to ask about how you're doing. There are even medications now that phone home to verify that the patient has taken the medicine, and you can track adherence. So all of these kinds of electronic devices and electronic mobile kind of technologies are going to assist us in taking care of our patients. As I said, there are text-based connections to track status. There are I/O dashboards that care managers are going to use. I mean, if your phone is really 3 to 4 feet away from you almost 24 hours a day, and someone who is a care manager can tell that your phone hasn't moved in a week, then there's a high level of possibility that you haven't moved in a week, and that will bring about the question of, how are you doing? Are you in bed? Are you sick? Have you stopped taking your medicine? Are you ill? Are you suicidal? Is there some way we can support you? And again, that is going to prompt communications or efforts to reach out and check in to see if care can be improved and if interventions might be necessary. So it is sort of the next stage, and it is something that could make us uncomfortable a little bit. But in a sense, if we can be private and trusting in how the information is utilized, allowing someone to communicate with us who has good intentions might be something that actually could make us do better, and we could be healthier and more well as well. The other thing that you're going to see a lot more about in the near term is an emphasis on the social determinants of health. There's an increasing recognition across the world that things outside of healthcare and outside of yourself matter in terms of impacting your health. Do you have a house to live in? Is there a roof over your head? Are you on the street? Do you have transportation? Are you employed? Is there someone in your life that's disrupting your health? Do you have food, and is your diet healthy? Are you connected to others in a social way that is healthy? So all of these things that are being broadly termed social determinants of health are now going to become part of things that are included in the healthcare package. So not only are we going to be prescribing medicine and doing physical examinations and blood tests and asking how people are doing, but there will be resources close at hand, perhaps even in the office, to make sure that people have adequate housing, adequate transportation, nutritional services, and other things that bridge the gap and make the likelihood of people who are trying to connect with healthcare can actually make that connection, and vice versa. Can healthcare providers and systems who are interested in and being paid for the quality, and again, that's that triple aim. Can we get care to more people at a better quality, at a lower cost? That's triple aim language, is all part of this. So you're trying to get as many pieces of the puzzle together. And then the pay for performance, the value-based reimbursement is there. Whether it's at-risk insurance agreements or pay for performance in general, again, whether you're talking commercial, Medicare, or Medicaid, those are things that have become reality now. Did you know that about 33%, maybe a little higher than that, of the seriously mentally ill population is being cared for by Medicaid? And if you have a serious mental illness, you're about 18% more likely not to have health insurance coverage. So there is an effort across the country to expand Medicaid services to make sure that Medicaid services are robust and rich and interdisciplinary and connected and including the social determinants of health and not just a doctor's office. All of those things are coming into play now with the idea of health is much broader than just a provider and a patient in a provider's office. So the idea is to make it, to reduce distances, to reduce obstacles. The last thing I want to mention is telehealth, the idea of connecting with providers via electronic mechanisms or through smart apps or Skype or Zoom or electronic communications like we're doing right now. I'm communicating with you through a video and it could be live. If I were a healthcare provider, I could be talking to you about your health via video. Our organization that I work for has electronic visits both in non-video and video formats now. And so 24 hours a day, you can reach a provider and have a video conversation with a provider in the organization that I work for. So this is going to become true for more and more people, and so healthcare is going to become more and more interdisciplinary, connected, and the distance between you and help is going to get smaller and smaller, and we hope that's going to increase access, increase quality, and reduce cost for everyone.